the most disgusting Viking medical treatments that worked. Welcome to a journey into Viking medicine, where brutal survival met raw ingenuity. The Vikings might be famed for their raids and voyages, but their medical practices were equally fascinating, and often downright disgusting. Today, we'll explore some of the most stomach-turning Viking medical treatments that actually work. From bloodletting with leeches to using rancid fats and fermented fish as antiseptics, Viking healers combined herbal lore, trial and error, and bold experimentation. Their remedies may sound repulsive, but many had surprising healing power. Get ready for a deep dive into a world of gore, guts, and grit, the strange but effective Viking medicine you've never heard about. The bloodletting ritual, draining evil. Bloodletting was common in many ancient cultures, but Vikings believed it released bad blood or evil spirits causing illness. They used special knives or leeches to draw blood from specific veins. We'll explore how controlled bloodletting helped reduce fever, lower blood pressure, and combat infections. Archaeological finds show sharp surgical tools Viking doctors used, and sagas describe healers performing bloodletting during battle wounds. While gruesome, this method sometimes saved lives by reducing dangerous swelling or purging toxins. Bloodletting was a widespread medical practice that spanned many ancient civilizations. Egyptians, Greeks, Romans, and Chinese all engaged in forms of it. The Vikings were no exception. In their worldview, illness was often caused by an imbalance within the body, or even by the presence of evil spirits and bad blood. To restore health, removing this corrupted blood was believed essential. This cultural belief transformed bloodletting from a simple medical procedure into a ritual act aimed at purging disease and restoring balance, both physically and spiritually. The Viking belief in bad blood and evil spirits. In Viking culture, health was seen as a delicate balance between bodily humors, spiritual forces, and natural elements. Illnesses were frequently interpreted as the result of supernatural influence as spirits, curses, or divine displeasure. When someone fell ill, the cause wasn't always understood in modern scientific terms, but the symptoms suggested something dark or harmful had entered or corrupted the body. Blood was considered the life force, and tainted blood was thought to carry illness or malevolent entities. Removing bad blood through bleeding was believed to release these forces, purifying the patient and allowing healing to begin. This spiritual dimension added a layer of importance and urgency to the procedure, often accompanied by ritualistic prayers, chants, or incantations to aid the process. Methods and tools of bloodletting. The Vikings employed several methods to draw blood, the two most common being incisions with special knives and the use of leeches. Surgical instruments. Archaeological excavations have uncovered finely crafted knives, often made of iron, with sharp, precise edges ideal for making controlled cuts. These were known as lancets or fleams. Some of these tools show signs of wear consistent with medical use. The blades were designed to access specific veins, such as those on the arm or leg, to release a controlled amount of blood without causing excessive harm. Leeches. Although less commonly documented than knives, the use of leeches was known across northern Europe. These blood-sucking worms were prized for their ability to draw blood gently and steadily, reducing the risk of infection and excessive bleeding. Leeches were often applied to swollen or inflamed areas to reduce pressure and promote healing. The choice of method depended on the patient's condition, the location of the ailment, and the healer's preference or skill. The therapeutic goals of bloodletting. Bloodletting was thought to serve multiple therapeutic purposes, reducing fever. Fevers were common and dangerous, especially after injuries or infections. Removing blood was believed to cool the body, relieve inflammation, and restore balance. Lowering blood pressure. Excessive blood volume was thought to strain the heart and organs. Bleeding relieved this pressure, easing symptoms like headaches or dizziness. Combating infections and swelling. In battle wounds, inflammation and swelling often led to fatal complications like gangrene. Drawing blood was believed to drain harmful substances and reduce swelling, preventing further damage. Purging toxins. The Vikings had no concept of germs but recognized the presence of poison or harmful substances. Bloodletting was a crude but sometimes effective way to expel these. Archaeological evidence. Several Viking Age burial sites have yielded fascinating clues about medical practices. Skeletal remains show signs of trepanation, skull surgery, and other interventions, but the presence of surgical knives confirms that bloodletting was practiced. The sharpness and fine design of these tools indicate a surprising level of medical craftsmanship. These instruments were often kept with the deceased, signaling their importance and the respect given to healers. Descriptions in sagas and historical accounts. Norse sagas and historical texts occasionally reference healing practices, including bloodletting. For example, some sagas describe warriors wounded in battle receiving immediate treatment where blood was drawn to prevent infection or death. Healers, often women called velvas or wise women, were respected figures who combined medical knowledge with spiritual practices. Their roles involved not only physical healing, but also counseling and performing rituals to protect the patient's soul. One saga recounts a healer who used bloodletting to save a chieftain's life after a deep wound threatened to fester. Though the procedure was painful and risky, the patient survived, and the story highlighted the healer's skill and bravery. Risks and limitations. While bloodletting sometimes helped, it was a double-edged sword. Excessive bleeding could weaken a patient or lead to death. Improper technique risked infection, especially in non-sterile environments. Without modern understanding of circulation or hygiene, the procedure's benefits were unpredictable. Yet, despite these risks, bloodletting remained popular for centuries because it often coincided with improvements in symptoms, whether due to placebo effects, the body's natural healing, or genuine relief from excess fluid and pressure. Modern perspectives. Why did bloodletting sometimes work? From a contemporary medical viewpoint, bloodletting's effectiveness in Viking times can be partly explained. Reducing pressure and swelling. Drawing blood from a swollen area can decrease internal pressure, improving circulation and preventing tissue damage. Lowering iron levels. In some chronic diseases involving iron overload, blood removal can reduce toxicity. Stimulating immune responses. Minor blood loss triggers the body to regenerate blood cells and repair tissue, possibly aiding healing. Moreover, the ritualistic nature of bloodletting helped reinforce community support and patient morale, factors known today to influence recovery. The cultural impact of bloodletting. Beyond physical effects, bloodletting held profound cultural and psychological importance in Viking society. It symbolized an active fight against disease and misfortune, demonstrating the patience and community's determination to heal. The ritual invoked divine favor, reaffirmed social bonds, and reinforced the healer's status. The act of drawing blood was both a medical procedure and a ceremonial purification. Bloodletting in context. The balance of ancient medicine. Bloodletting illustrates how Vikings blended practical observation with spiritual beliefs. They didn't have modern science, but developed methods based on experience, trial, and cultural frameworks. Their approach balanced empirical results, like noticing reduced swelling with mystical interpretations, making bloodletting a cornerstone of their medical tradition. Herbal poultices from rot to remedy. When we think of Viking medicine, images of fierce warriors wielding swords often come to mind. But behind the battle cries and epic sagas lay a sophisticated knowledge of natural healing gone that embraced the healing powers of the wild landscape. Among the many remedies used by Viking healers, herbal poultices played a central role. These poultices mixtures applied directly to wounds or infected areas were crafted from wild herbs, plants, and sometimes, surprisingly, substances that to modern sensibilities might seem revolting. Rotten fish, moldy bread, and fermented plants. Yet, these pungent concoctions were more than desperate attempts. They were effective treatments that sped healing and saved lives. Harnessing the power of wild herbs, the Viking world was rich with natural flora that possessed medicinal properties. Wise women, known as velvas or healers, gathered these wild herbs from forests, meadows, and coastal areas, selecting plants known to soothe pain, reduce inflammation, or fight infection. Common herbs used in poultices included yarrow, known for its ability to stop bleeding and reduce inflammation. It was often crushed and applied to wounds to promote clotting. Nettle, though its sting was painful, nettle had anti-inflammatory and antiseptic qualities. Leaves were used in poultices to ease swelling and infection. Mugwort, used to alleviate pain and stimulate circulation. Comfrey, sometimes called knitbone, comfrey leaves were applied to broken bones and wounds to encourage tissue repair. These herbs were often mashed or ground into pastes and combined with fats or other binders to create a thick poultice. When applied to wounds, the poultice would keep the area moist, draw out impurities, and protect against further contamination. The surprising use of rotten and fermented substances. What sets Viking poultices apart from many other ancient medical traditions is the inclusion of substances that seem counterintuitive or outright disgusting: rotting fish, moldy bread, fermented plants, and other decayed organic matter. To the modern nose, these smell foul, even dangerous, but these poultices had a hidden secret. They contained natural antiseptics. The Vikings discovered through trial and error that applying such materials to wounds often prevented putrefaction and promoted healing. How? The answer lies in the microbial processes involved in fermentation and decay. As organic matter breaks down, it produces certain acids and compounds like lactic acid, ammonia, and various phenols that inhibit harmful bacteria. These compounds create an environment hostile to pathogens, preventing infections from taking hold or spreading. Mold and early antibiotics, a fortuitous discovery. One of the most remarkable aspects of Viking poultices is their accidental use of molds with antibiotic properties, similar to the modern drug penicillin. Penicillin comes from the penicillium mold, discovered scientifically only in the 20th century, but many molds were used in folk medicine long before that. Moldy rye bread, a staple in Viking diets, was often found covered with penicillium or related species. When mashed into a poultice and applied to wounds, these molds released antimicrobial compounds that slowed or stopped bacterial growth. This natural antibiotic effect helped prevent infections like gangrene, a deadly complication of battle wounds common in Viking warfare. Historical and archaeological evidence suggests that Viking healers recognized the benefits of mold, even if they lacked the scientific understanding we have today. Their empirical knowledge, built over generations, was sophisticated in its practical outcomes. The science behind the smell. The strong, unpleasant odors emitted by these poultices were often off-putting, but they indicated chemical activity that was beneficial. The pungent smell came from volatile compounds produced during fermentation or decay, compounds that also had antimicrobial effects. In modern medicine, similar compounds are used to preserve food and in some antiseptic products. The Vikings harnessed these effects naturally, turning what we consider rot into a remedy. Application techniques and cultural context. Applying poultices was an art. Healers prepared the mixtures carefully, often combining multiple ingredients for synergistic effects. Poultices were spread over cloth or animal skins and pressed against wounds or swollen areas, then secured with strips of linen or leather. Treatment was often accompanied by ritual, prayers to the gods, incantations, and the use of runes reinforced the healer's authority and the patient's confidence. The spiritual aspect of healing was intertwined with the physical treatment, reflecting the holistic Viking view of health. Stories of healing, warriors who survived. The brutal nature of Viking warfare meant that wounds were common and often severe. Without modern antibiotics or surgical techniques, infections could easily become fatal. Yet many warriors survived, thanks to timely treatment with these poultices. One saga recounts a chieftain struck by an arrow that pierced deeply. As his wound festered, the healer applied a poultice made of crushed yarrow and moldy bread soaked in fermented fish oils. The smell was terrible, but the wound began to heal where others might have rotted. The chieftain recovered, returning to battle, and later leading his people to victory. Archaeological studies of Viking burial sites have uncovered bones showing signs of healed infections, suggesting that these treatments were effective in real life, not just folklore. Comparing Viking poultices to other ancient cultures. Viking use of herbal and fermented poultices shares similarities with other ancient healing traditions, such as the use of honey and moldy bread in Egyptian and Greek medicine. However, the Vikings' harsh environment and reliance on marine resources influenced their unique recipes and approaches. The emphasis on fermentation and decay as a healing tool highlights Viking ingenuity, adapting available resources to meet medical needs in a challenging climate. Modern perspectives on Viking herbal medicine. Today, modern science validates many Viking herbal remedies. Research confirms that yarrow, nettle, and comfrey have anti-inflammatory, analgesic, and wound healing properties. Studies on fermentation show that the acids and compounds produced can inhibit bacteria. The accidental discovery of natural antibiotics in moldy foods prefigured modern pharmacology. Viking poultices exemplify how traditional knowledge, grounded in observation and experimentation, can align with scientific principles long before their formal discovery. Using animal fats and glands, the greasy cure of the Vikings. When we think of Viking medicine, the image of a warrior applying salves made from animal fats may not be the first thing to come to mind, yet these greasy remedies formed a vital part of their healing arsenal. The Vikings, living in a world where the natural environment dictated survival, turned to every available resource, including the fats and secretions of animals, to treat burns, wounds, joint pain, and other ailments. This practice was a fascinating blend of practical biology and spiritual belief, revealing a culture that valued both the physical and mystical aspects of healing. The practical use of rendered animal fats. Rendered animal fat, the melted down fat from cows, pigs, seals, or fish, was a common ingredient in Viking ointments. Fat has properties that made it an excellent base for topical applications. When applied to the skin, it created a protective barrier that helped seal wounds, kept them moist, and prevented them from drying out and cracking. This barrier reduced the risk of infection by limiting exposure to air and bacteria. Even fats that had become rancid were still used, a practice that might seem counterintuitive today but actually had medicinal benefits. Rancid fats, through the process of oxidation, break down into compounds that can have antimicrobial effects. While these fats might smell unpleasant, they could help keep wounds clean and inhibit bacterial growth in the absence of modern antiseptics. Animal fats also help deliver other medicinal ingredients to the skin. Herbs, resins, and secretions were often mixed with the fats to create salves with combined healing properties, anti-inflammatory, analgesic, or antiseptic effects that soothed pain and accelerated recovery. Treating burns, cuts, and joint pain. Burns were a common injury for Vikings due to open hearth fires inside their wooden and turf homes. Applying fatty salves helped soothe the burned skin and protected it from drying and cracking, which could worsen pain and risk infection. Cuts and abrasions from battles, farming, and daily labor were treated with these ointments to protect the injured area. The fat base kept the wound moist and created a seal, while added herbs could fight infection and reduce inflammation. Joint pain, arthritis, and muscle aches were common among Viking adults who endured harsh physical labor and battle injuries. Animal fat mixed with warming herbs was applied as a massage ointment to relieve stiffness and soreness. The fat helped carry the herbal compounds deep into the tissues, while the act of massaging promoted circulation and healing. The use of secretions from animal glands. Beyond rendered fat, Viking healers also used secretions from animal glands, specialized organs that produce substances with medicinal or symbolic significance. For example, the oil from fish livers was rich in vitamins and was sometimes applied topically or consumed for its health benefits. Seal and whale blubber were used not only for fuel and food, but also for their healing properties. The thick, oily blubber was believed to protect and nourish the skin, especially in the cold northern climate, where frostbite and dry skin were common. Some glands produced secretions with strong odors or distinctive textures, which Vikings associated with the animal's strength or vitality. Using these secretions in healing rituals was thought to transfer the animal's power to the patient, enhancing the treatment's effectiveness. The ritualistic and spiritual aspect of animal-based medicine. Viking medicine was never purely physical. Healing involved a blend of tangible treatments and spiritual practices. The use of animal fats and gland secretions was infused with ritual significance. Animals were seen as sacred beings or messengers of the gods, and their parts carried symbolic power. When a healer applied a salve made from an animal's fat or gland secretion, it was not just about the chemical effects. It was a ceremony that honored the animal's spirit and sought its blessing. The ritual might include prayers, chanting runes, or offerings to deities associated with health and protection. This spiritual dimension reinforced the psychological and social effects of the treatment. The patient's belief in the salve's power, combined with community support and ritual, could boost morale and contribute to recovery, an early example of the placebo effect in action, combining practicality and belief. The Viking use of animal fats and glands exemplifies how practical observation and mystical belief coexisted in ancient medicine. Without modern chemistry or microbiology, Vikings relied on experience and cultural understanding. They observed that greasy salves protected wounds and eased pain, and they incorporated symbolic meanings that gave treatments deeper significance. This holistic approach treated not just the body but the mind and spirit. Modern science and animal fat remedies. Interestingly, modern medicine recognizes several benefits of animal fats and oils in skincare. Fatty acids found in animal fats help maintain the skin's barrier, retain moisture, and reduce inflammation. Today, many moisturizing creams and ointments contain lanolin from sheep's wool or fish oils for similar reasons. Furthermore, Omega-3 fatty acids from fish oils have documented anti-inflammatory effects, which likely contributed to the relief Viking ointments provided. The bizarre, yet effective legacy. For us, the idea of smearing rancid fat or animal gland secretions on wounds may be off-putting, but in the Viking world, these treatments were lifelines. They represent the intersection of biology, culture, and spirituality and ancient wisdom that used every part of the animal to heal the human. This greasy cure stands as a testament to Viking resourcefulness, turning raw nature into potent medicine through a combination of empirical knowledge and reverence for the natural and supernatural world. Animal fats and gland secretions were more than mere ingredients in Viking healing. They were carriers of power, protection, and life. These greasy salves created physical barriers against infection, delivered soothing and anti-inflammatory compounds, and connected the patient to the spiritual realm through ritual. Together, biology and belief forged treatments that might seem bizarre today but saved countless lives. Viking medicine was a delicate balance of the practical and mystical, and animal fats remain a fascinating example of this ancient blend of science and spirit. Fermented fish and hakarl in healing. When many people think of Viking food, one dish often stands out for its reputation and pungency: hakarl, the fermented Greenland shark. Known for its powerful ammonia-rich smell and acquired taste, hakarl is one of the most infamous Viking delicacies. But beyond its role as a food source, hakarl and other fermented fish products had surprising medicinal uses in Viking society. These smelly, seemingly repulsive substances were integral to Viking healing practices, used to clean wounds, prevent infection, and promote recovery. This segment explores the fascinating role of fermented fish in Viking medicine and reveals how fermentation transformed dangerous toxins into powerful antiseptics. The challenge of the Greenland shark. The Greenland shark, Somniosus microcephalus, is a large, slow-moving species inhabiting the cold Arctic and North Atlantic waters around Greenland and Iceland areas well within Viking reach. While it provided a valuable source of meat and fat, the raw flesh of the Greenland shark is highly toxic. This toxicity comes from high levels of urea and trimethylamine oxide, TMAO, in its tissues. Eating fresh Greenland shark meat causes severe poisoning, including nausea, vomiting, and neurological symptoms. Faced with this danger, Viking communities developed an ingenious method to render the shark edible: a lengthy fermentation process that detoxified the meat while preserving it for months. This process involved gutting the shark, burying it underground or in gravel pits for several weeks to months, and then drying the meat in open air. The fermentation allowed bacteria to break down urea and TMAO, removing the toxic components but leaving behind a potent aroma of ammonia. Hakarl, food and medicine. While today, hakarl is primarily considered a traditional food eaten during cultural festivals like Iorablot in Iceland, historical evidence suggests it was also used medicinally in Viking times. Viking healers recognized that the fermentation process produced chemical compounds with antimicrobial properties, making the fermented fish a useful antiseptic. In the absence of modern disinfectants, Viking medicine relied heavily on natural substances to prevent infections, one of the most dangerous threats after battle injuries or accidents. The antiseptic qualities of fermented fish made it ideal for cleaning wounds, especially those prone to gangrene or other bacterial complications. Some historians and medical anthropologists speculate that Viking healers soaked bandages or cloth strips in liquids derived from fermented fish, applying these to wounds to inhibit microbial growth. The pungent smell, rather than being a drawback, was a sign that the antiseptic agents were active and working to protect the patient. The science behind fermentation and antiseptic properties. Fermentation is a process by which microorganisms such as bacteria and fungi break down organic compounds. In the case of hackarl and other fermented fish products, this microbial action transforms toxic substances into less harmful ones and produces organic acids, ammonia, and other compounds with antimicrobial effects. The ammonia released during fermentation is particularly effective at killing many types of bacteria. It creates an alkaline environment that inhibits microbial growth, similar to how modern antiseptics work by creating hostile conditions for pathogens. Moreover, fermentation increases the concentration of certain bioactive peptides and amino acids that may promote tissue repair and reduce inflammation. This natural chemical transformation essentially turns what was once deadly fish meat into a powerful wound cleanser, capable of reducing infection risk in a time before antibiotics. Historical and archaeological evidence. Although direct written records of Viking medicinal use of hackarl are scarce, archaeological findings and comparative studies provide clues. Sagas and oral traditions. Some Norse sagas and folk tales reference the use of fermented fish oils and extracts in healing practices. These narratives often emphasize the importance of purification and protection from disease, hinting at the medicinal role of fermented fish products. Archaeological finds. Viking burial sites and settlements have yielded evidence of fish drying racks and fermentation pits, underscoring the importance of fermented fish in Viking life. The presence of fish oils and residues on healing tools or bandages suggests their application in medical contexts. Comparative ethnography. In other northern and indigenous cultures, fermented fish has been used medicinally for centuries, supporting the idea that Vikings might have employed similar practices. How wounds were treated with fermented fish. In battle or during daily life, Vikings frequently suffered wounds that could quickly become infected. Without antiseptics, infections were a leading cause of death. The typical procedure might have included cleaning the wound, using fresh water or herbal decoctions to remove dirt and debris, applying fermented fish extracts. Bandages soaked in fermented fish liquids or oils would be wrapped around the wound. The antimicrobial properties helped prevent bacterial growth. Covering with herbal poultices. Additional plant-based salves might be layered to provide moisture and soothe tissue. Changing dressings regularly to maintain cleanliness and allow healing. The pungency of fermented fish served as a warning sign that the medicine was active and potent. Despite the smell, patients who received these treatments often survived infections that might have been fatal otherwise. The dual role of fermentation. Preservation and healing. One of the greatest advantages of fermentation in Viking times was its dual functionality. Fermentation preserved fish for months or even years, ensuring a reliable food source during harsh winters and lean times. At the same time, it produced bioactive compounds useful in medicine. This synergy was vital in a society with limited resources and no refrigeration. Healers made efficient use of available materials, turning food preservation techniques into medical treatments, demonstrating Viking adaptability and resourcefulness. The cultural dimension. Smell, power, and healing. The strong ammonia odor of hackarl and fermented fish products was both a sensory challenge and a cultural symbol. Symbol of potency. The intense smell was associated with strength and effectiveness. In Viking culture, powerful odors often had protective and spiritual significance, believed to ward off evil spirits and disease. Ritual healing. Healing was a holistic process involving the body, mind, and spirit. Applying fermented fish was sometimes accompanied by prayers, chants, or rune inscriptions, reinforcing the belief that medicine and magic worked hand in hand. Communal trust. The social acceptance of such pungent remedies reflected a collective trust in traditional knowledge and healer authority, factors critical to patient compliance and recovery. Trepanation drilling into the skull. Trepanation, the practice of drilling or scraping holes into the human skull, is one of the oldest known surgical procedures. While it might sound barbaric or even unimaginable to us today, it was surprisingly common and, importantly, sometimes life-saving among the Vikings. Archaeological and historical evidence reveals that the Vikings were not only fierce warriors, but also skilled practitioners of this daring form of surgery, demonstrating an advanced understanding of anatomy and the physical consequences of head injuries. What is trepanation? Trepanation involves creating an opening in the skull by scraping, drilling, or cutting through the bone. This practice dates back tens of thousands of years and has been found in prehistoric skulls around the world from Neolithic Europe to ancient Peru. In the Viking context, trepanation was performed primarily to address head injuries sustained in battle or accidents, but it may also have been used to treat neurological disorders such as severe headaches, seizures, or mental illness as conditions that the Vikings and their healers attributed to imbalances or spirits trapped in the head. The idea was to relieve intracranial pressure, the dangerous buildup of fluids or swelling inside the skull that can cause brain damage or death. By drilling a hole, the healer could allow the pressure to escape, reduce pain, and potentially save the patient's life. Archaeological evidence. Skulls that tell stories. One of the most compelling proofs of trepanation among Vikings comes from archaeological excavations of burial sites across Scandinavia and Viking settlements. Healed trepan skulls. Several skulls have been discovered with round or oval holes, some quite large, that show clear signs of healing. The bone around these openings had begun to grow back, indicating that the person survived the surgery by weeks, months, or even years. This is a remarkable indication of surgical success in a pre-modern context. Multiple surgeries. In some cases, skulls show evidence of more than one trepanation attempt, suggesting persistent medical efforts and that some patients underwent repeated treatments. Location of trepanation. The holes were often located near the forehead or temples, areas most vulnerable in combat. The placement suggests that the procedure was targeted, likely based on symptoms or injury sites. These discoveries paint a vivid picture. Trepanation was not a random or mystical act, but a purposeful, skillful surgical intervention. Tools of the trade. Trepanation required specialized tools capable of penetrating the thick cranial bone without damaging the delicate brain beneath. Scrapers and drills. Viking surgeons used scrapers with sharp, curved edges to gradually grind away the bone. These could be made from iron or flint, sharpened meticulously to avoid slipping. Bow drills. Archaeologists have found evidence suggesting the use of primitive drills powered by a bow mechanism, which allowed for more precise and controlled penetration. Careful technique. Rather than punching a hole all at once, the procedure was typically performed slowly, scraping or drilling layer by layer. This minimized trauma and gave the patient a better chance of survival. The skill required to perform trepanation safely cannot be overstated. Healers needed steady hands, deep anatomical knowledge, and considerable courage both from themselves and the patient. The patient's courage and experience. Undergoing trepanation would have been terrifying. There was no anesthesia, no antiseptics, and no modern surgical environment. The patient would have had to endure the pain of having their skull scraped or drilled while remaining as still as possible. Despite these challenges, the evidence of healing shows many Viking patients survived. This implies that healers, may have used rudimentary pain management techniques. Herbs with mild sedative effects or alcohol might have been administered. Patients also likely understood the gravity of their condition. Head injuries can cause severe symptoms such as headaches, confusion, seizures, or unconsciousness, which might have made the risk of surgery worth taking. Purposes beyond physical relief. While relieving physical pressure was a primary goal, trepanation in Viking culture probably held spiritual and symbolic meaning. Releasing spirits. Vikings believed that spirits or malevolent forces could become trapped in the head, causing illness or madness. Creating an opening in the skull was thought to release these spirits and restore balance. Ritual healing. Trepanation may have been accompanied by prayers, incantations, or other rituals to ensure the patient's spiritual well-being alongside the physical. Mark of the healer's power. Successfully performing such a dangerous operation elevated the status of the healer, reinforcing their role as both medical expert and spiritual guide. Survival rates and surgical success. The fact that many trepanned skulls show healing is remarkable. In a time without modern infection control, surgical instruments, or antibiotics, infections and complications were common causes of death after injury. That Vikings achieved survival rates allowing bone regrowth suggests several factors. Sterilization. Although they didn't understand germs, Viking healers might have practiced some form of tool cleaning, perhaps using fire or herbal rinses with antiseptic properties. Skill and caution. The slow, deliberate scraping method reduced the risk of brain injury. Post-operative care. The patient may have received herbal poultices, animal fats, or fermented fish extracts, as discussed in earlier segments, to prevent infection and promote healing. Trepanation. In the broader context of Viking medicine, trepanation was one of many medical practices in the Viking toolkit. It illustrates the sophistication and bravery of Viking healers who combined empirical knowledge with spiritual beliefs. It was not a first-line treatment, but a response to severe condition head trauma from battle wounds, falls, or disease. It reflects an advanced understanding of human anatomy and a willingness to intervene aggressively to save lives. Comparisons to other cultures. Trepanation was not unique to the Vikings. Ancient Egyptians, Greeks, Native Americans, and many other cultures practiced it. However, the Viking practice was notable for its frequency and success rates given the harsh conditions. The evidence of healed trepanned skulls in Viking cemeteries suggests it was a well-integrated part of their medical tradition. The gruesome reality and the legacy. From a modern perspective, the idea of drilling into a skull without anesthesia or sterile environments is chilling. Yet, for the Vikings, it was a calculated risk with the potential to save a life threatened by brain swelling or injury. This practice challenges our assumptions about ancient medicine, revealing a complex interplay of courage, knowledge, and belief. It also highlights the Vikings' willingness to confront pain and death head-on, embodying their cultural values of strength and endurance. Hot stones and heat therapy. Heat therapy is an ancient healing technique that predates recorded history, and the Vikings were among the early practitioners who understood its therapeutic benefits. Though their medical knowledge was rooted in observation and tradition rather than modern science, Vikings harnessed the power of heat most, notably through the use of heated stones and the enduring cultural practice of sauna bathing to alleviate pain, promote healing, and restore physical vitality. This segment explores how heat therapy was integrated into Viking medicine, its practical applications for warriors and common folk alike, and its lasting legacy in Nordic health traditions. The therapeutic role of heat in Viking medicine. For the Vikings, life was physically demanding. From the rigors of raiding and warfare to the everyday labor of farming and shipbuilding, Viking bodies endured significant strain. Injuries such as bruises, sprains, joint pain, and muscle soreness were commonplace. Chronic conditions like arthritis, caused by repetitive physical stress and injuries, affected many. Without access to modern painkillers or anti-inflammatory drugs, the Vikings turned to natural and non-invasive treatments to manage pain and aid recovery. Heat therapy, applying warmth to the body, was one such method. Heated stones were the primary tool for delivering this therapy. Stones were warmed in the fire and then applied directly to affected muscles, joints, or aching limbs. The heat penetrated deep tissues, increasing blood flow to the area, relaxing tense muscles, and reducing stiffness. These effects helped relieve pain, promote healing, and restore mobility. The use of heated stones. Practical applications. Vikings likely used various types of stones, selected for their heat retention and smoothness to minimize skin injury. Stones from riverbeds or volcanic regions, which could hold heat evenly and safely, were ideal. How heated stones were applied. Direct contact. Stones heated to moderate temperatures were carefully placed or pressed against painful areas. Their warmth stimulated circulation, bringing oxygen and nutrients essential for tissue repair. Massage. Stones could be used as massage tools, rolled or pressed along muscles and joints to loosen tightness and improve flexibility. Warm compresses. Heated stones wrapped in cloth or animal skins functioned as warm compresses, providing soothing relief without risking burn. The careful application ensured that the heat was therapeutic rather than harmful. Patients likely had to endure some discomfort as stiffness eased, but the overall effect was pain relief and increased function. Heat therapy for battle injuries. Battlefield injuries were brutal and varied blunt trauma, cuts, bruises, and broken bones. Heat therapy provided Vikings with a non-invasive way to manage pain and inflammation, especially for soft tissue injuries. Applying heated stones to sprains and bruises helped reduce swelling and hastened recovery, allowing warriors to regain strength faster. For chronic joint pain resulting from repeated injuries or arthritis, heat soothed discomfort and improved mobility. Heat therapy complemented other treatments such as poultices and salves, creating a multi-pronged approach to healing. Sauna culture, more than just relaxation. Heat therapy in Viking society was not limited to heated stones. The sauna, a practice deeply embedded in Nordic culture for thousands of years, was an essential aspect of health and wellness. Sauna small rooms heated by stones and fire provided intense dry heat, inducing sweating and muscle relaxation. The Vikings used saunas not only for hygiene, but also for medicinal and social purposes. The intense heat relieved muscle pain. Sweating in the sauna loosened muscles and joints, helping to relieve soreness and stiffness. Improved circulation. The heat caused blood vessels to dilate, increasing blood flow and promoting tissue healing. Detoxification. Sweating was believed to purge toxins from the body, supporting overall health. Stress reduction. The calming environment and physical relief reduced stress, which plays a role in pain perception and healing. Saunas also served as communal spaces where stories were told, disputes settled, and social bonds strengthened. This holistic integration of physical, mental, and social healing reflects Viking understanding of health as a complex balance. The science behind heat therapy. Modern medicine validates many of the effects Vikings observed through experience. Increased blood flow. Heat causes vasodilation, widening blood vessels and enhancing oxygen and nutrient delivery to tissues. Muscle relaxation. Warmth reduces muscle spindle sensitivity, decreasing muscle spasms and tension. Pain relief. Heat stimulates sensory receptors that override pain signals, the gate control theory, offering natural analgesia. Enhanced flexibility. Heat increases the elasticity of muscles and connective tissues, improving range of motion. These physiological responses explain why heat therapy remains a cornerstone of physical rehabilitation today. Heat therapy for chronic conditions. Arthritis, a degenerative joint disease causing pain and reduced mobility, likely afflicted many Vikings. Although they had no knowledge of the disease's pathology, they understood its symptoms and sought relief. Heated stones and saunas provided non-pharmacological treatment to ease joint stiffness and pain, improving daily function and quality of life. Regular exposure to heat helped maintain joint flexibility, allowing elders and laborers to continue their work despite chronic discomfort. Ritualistic and symbolic dimensions. The use of heat in Viking medicine was not merely physical, but often imbued with spiritual meaning. Fire and heat were sacred elements in Norse mythology, symbols of transformation, purification, and life. Saunas and heated stone treatments could be accompanied by rituals or prayers to gods like Thor, protector of mankind, and wielder of lightning and fire. The healing process might be seen as a renewal of the body's life force, cleansed and strengthened by elemental heat. This spiritual aspect enhanced the therapeutic experience, providing psychological comfort and reinforcing the healer's authority. Preparing and maintaining heated stones. The preparation of heated stones was an essential skill. Stones had to be heated to the right temperature. Too cool, and they would be ineffective. Too hot, and they could burn the skin. Vikings used fire pits or hearths to heat stones gradually, sometimes placing them in ashes or embers to maintain steady warmth. The stones were often wrapped in cloth or animal hides before application to prevent direct burns. Healers had to monitor temperature carefully, using intuition and experience rather than thermometers. This knowledge was passed down orally, forming part of the community's healing traditions. Heat therapy and recovery time. While heat therapy did not cure injuries outright, it significantly aided the recovery process by managing symptoms and preventing complications. By reducing pain and stiffness, it enabled injured Vikings to gradually return to physical activity, an important factor in healing. Combined with other treatment herbal poultices, animal fat salves, and Riesthiat therapy formed a comprehensive approach to healthcare, balancing active and passive healing strategies. The continuation of heat therapy in Nordic cultures. The Viking tradition of heat therapy laid the groundwork for enduring cultural practices in the Nordic countries. Modern Scandinavian societies continue to celebrate sauna culture, not only as relaxation, but as a health practice supported by scientific research. The concept of cold plunge and hot sauna remains popular, believed to stimulate circulation and boost immunity. Heated stone massage, hot rock therapy, and other forms of heat treatment are staples of contemporary physical therapy and wellness centers worldwide, reflecting the lasting influence of these ancient techniques. The Viking insight into pain management. The Vikings understood that healing was not only about curing wounds, but managing pain and restoring function. Heat therapy was a non-invasive, drug-free way to address these goals. This insight is notable because it predates the development of modern analgesics and anti-inflammatory medications. Their empirical approach highlights the importance of symptom relief in the healing journey, a principle still central to medicine today. This extensive exploration shows that Vikings were not merely warriors of brute force, but also skilled practitioners of physical therapy, employing heat to alleviate suffering and enhance recovery. Their use of heated stones and saunas was a sophisticated and integral part of their health practices, combining practical healing with cultural and spiritual meaning. Honey and beeswax, nature's healing balm. In the rugged world of the Vikings, where harsh climates and frequent injuries posed constant threats, nature's gifts were often the most reliable sources of healing. Among these, honey and beeswax stood out as invaluable tools not just for nourishment, but as potent remedies in the Viking medical arsenal. These products of the humble bee were treasured for their remarkable healing properties, forming the basis of salves and dressings that promoted recovery and protected against infection. This segment explores how Vikings utilized honey and beeswax in medicine, their significance in daily life, and the enduring legacy of these natural balms in modern healthcare. Honey, more than sweetness. Honey has been used medicinally for thousands of years across various cultures, and the Vikings were no exception. While its sweetness made it a prized food providing energy and flavor, in a diet often marked by scarcity, its medicinal value was equally appreciated. The Vikings applied honey as a wound dressing, leveraging its natural antibacterial properties. The sticky texture of honey acted as a physical barrier, sealing wounds against dirt and microbes. More importantly, honey's high sugar content created an environment inhospitable to bacteria. It draws moisture from the surroundings and, paradoxically, from bacteria themselves, dehydrating and killing them. Honey also contains enzymes that produce small amounts of hydrogen peroxide, a mild antiseptic, further inhibiting bacterial growth. Its acidity, low pH, adds another layer of antimicrobial action, preventing many pathogens from thriving. By keeping wounds moist, honey facilitated tissue repair and reduced scarring. Modern wound care often employs similar principles, using hydrocolloid dressings and honey-based products for chronic and acute wounds. Beeswax, the healing sealant. Beeswax, another product of bees, was a vital component in Viking topical treatments. It was often combined with animal fats or plant oils to create ointments and salves for skin ailments, burns, and wounds. The waxy consistency of beeswax allowed these salves to form a protective layer over the skin, preventing moisture loss and shielding wounds from contaminants. This barrier function was crucial in cold, damp Nordic climates where exposure to harsh weather could impede healing. In addition to its physical properties, beeswax contains antioxidants and antimicrobial compounds that support skin health and combat infection. The creation of these salves required skilled preparation, blending beeswax with other ingredients to achieve the right texture and potency. These preparations were sometimes infused with healing herbs like yarrow or comfrey to enhance their effectiveness. Daily and ritualistic roles of bees, honey, and wax. Bees, honey, and wax held special places in Viking culture beyond their practical uses. Bees were often regarded as magical or sacred creatures, symbols of industry, fertility, and community. Their products were gifts from nature, embodying life's sweetness and resilience. Daily life. Honey was a primary sweetener in Viking diets, used to flavor the fermented honey beverage beloved in Norse society. Beeswax was essential for making candles, providing light in long, dark winters. Healing rituals. Honey and beeswax featured in healing ceremonies and offerings. Applying honey to wounds was sometimes accompanied by prayers or rune carvings, invoking divine protection and strength. Trade and economy. Honey and wax were valuable trade commodities, exchanged across Viking routes, reaching as far as the Middle East and Byzantium. Their importance extended beyond medicine into the economic and social spheres. Modern science validates ancient wisdom. Contemporary research confirms the efficacy of honey and beeswax in wound management. Antibacterial effects. Studies show that honey inhibits growth of many bacteria, including antibiotic-resistant strains. Manuka honey, for example, is widely used today in medical-grade wound dressings. Anti-inflammatory properties. Both honey and beeswax reduce inflammation and promote tissue regeneration. Moisture regulation. Maintaining a moist wound environment speeds healing and reduces discomfort, a principle practiced by Vikings centuries ago. Skin barrier repair. Beeswax supports the skin's natural barrier, aiding recovery from burns, eczema, and other irritations. Stories of healing. Honey and Viking medicine. Historical and archaeological evidence points to the extensive use of honey in Viking medicine. Archaeologists have found honey residues in Viking Age burial sites and medicinal containers, indicating its role in healing. Written sources, including sagas and traditional lore, praise honey's curative powers. For instance, the Havamala collection of Old Norse wisdom mentions honey's restorative quality. Warriors recovering from wounds often had their injuries treated with honey dressings, preventing infection in environments where sanitation was limited. Mothers used honey-based salves for their children's skin ailments, leveraging its soothing and protective effects. Preparation and application of honey and beeswax remedies. Viking healers prepared remedies carefully. Raw honey, applied directly to wounds or mixed with herbs. Salves, beeswax melted and blended with animal fats and honey to create ointments. Bandages, cloth soaked in honey or wax-based salves were wrapped around injuries to maintain moisture and cleanliness. These applications required skill to balance stickiness, adherence, and healing properties, ensuring patient comfort and effective treatment. The enduring legacy. The medicinal use of honey and beeswax is one of the few aspects of Viking medicine that has a direct lineage to modern healthcare practices. Today, medical honey is widely used in hospitals worldwide for treating burns, ulcers, and chronic wounds. Its natural antimicrobial action offers an alternative in the age of rising antibiotic resistance. Beeswax is a staple ingredient in many cosmetic and pharmaceutical products, valued for its emollient and protective properties. The Vikings' intuitive use of these natural products reflects a deep connection to their environment and an empirical understanding of nature's healing potential. Lessons from Viking medicine for today. This detailed exploration reveals that honey and beeswax were far more than simple substances to the Vikings. They were powerful healing balms, bridging the physical and spiritual worlds. Their use underscores the sophistication of Viking medicine and its lasting impact on the art of healing. What can modern medicine learn from Viking treatments? While some practices are obviously outdated, others, like the use of honey or herbal poultice, inspired current medical advances. Thanks for watching our deep dive into Viking medicine's most disgusting yet effective treatments. If you enjoyed this journey through history's grimmiest healing secrets, please like, subscribe, and comment below. What other ancient or strange medical practices should we explore next? Let us know.